Hello, and we're live. We're live. So, good evening, everyone, and welcome back to Makati House. It is 8 p.m. in Manila and 1 p.m. in London. Hello, all. Hello, all. Hello to all who are joining us here on Clubhouse, and also to those tuned in on Facebook, Twitter, and YouTube. So, just a reminder that this room tonight is being recorded and also restreamed to other platforms, as mentioned. So, my name is JP. I am your moderator for tonight here at Makati House, and I am joined by my co moderator, Jen. Hi, Jen. Say
Hello,
hi to everyone.
hello. Yes, hello everyone. Welcome to McCarthy House.
Yes, and so we're also joined by by oops, sorry. We're also joined by Toni or Antoinette Tause, and she is an award winning actress, the founder of Planet CORA, also a singer, and a goodwill ambassador of the UN's Environment Program. And also on stage is Kat Triviño. She
Hello.
was my schoolmate, director at MindNation, and campaigns director at. Um, Tony, say hi to everyone.
Hello, everyone. Good evening, good afternoon, good morning, wherever you are. And thank you so much for being with us this evening. And of course, in honor of World Mental Health Day. Thank you so much for having us.
Thank you so much, JP, Jen, to the rest of the Makati House team for having Tony and I.
And thank you to Tony and Kat for lending your time this evening to talk about um, mental health, which is something that's not talked about enough, especially here in the Philippines. Brief intro: World Mental Health Day is tomorrow, October 10th, and this was started in 1992 by the World Health Organization. This is to increase awareness of mental health and to make it accessible to everyone. So this year's theme is World Health, sorry, mental health for everyone. And in the Philippines, the second week of October is also Mental Health Week. And oh yeah, and to correct what I said, this year's theme is mental health care for all. Let's make it a reality. Kat and Tony, and uh, Jen, what's our? So we prepared some questions for Kat and Tony. Sorry, and I apologize. I had too much coffee today. So Jen, why don't you go with the first question?
Wow, we've got a long list of questions. But um, Antoinette, would you kindly tell us, what leads you? I mean, what makes you chosen advocacy? You chosen advocacy. Why is it too close? Why is it too dear to your heart? And why are you putting a lot of effort, into this? If I may have Antoinette first, and then I'll have Kat next.
Sure, thank you. When you say advocacy, do you mean mental health or um, the other work that we do as well with our nonprofit, or do you mean all of it?
Well, let's go to the first one closest to your heart, and then the one that supplements it.
I would say everything. Maybe it's like pretty much equally close to my heart, to be honest. But I'll do it, I guess, in order of the events of my life that led me to where I am today. That might give a better perspective of the journey of how it all interconnects. Um, and I really wasn't raised an environmentalist. I wasn't really taught about sustainability growing up. I was just, I guess, raised um, to try to do the right thing, to always make the best decision as much as possible, to always try to do good, to help others. And I feel like that's what my mom always really stood for. And I was always very close to my mom. Her name is Cora, and the nonprofit organization Cora is actually named after her. And so all my life and growing up, she was really just someone that advocated for being there for others, helping others as much as you can, whether it's charitable work or being there for someone as a friend, and going the extra mile to help others that come to you for help no matter what, unconditionally, with no questions asked. So that's the kind of person she was. And in 2004, she passed away due to cancer. And after her passing, at the time, depression, mental health issues wasn't really something that was heavily discussed around the world, or even just in communities, or even in conversations with friends or even family members. I feel like back then, 2004, oh my gosh, that's almost 20 years ago, it had a lot of stigma. If it's ever brought up, people might seem like and act like it's taboo or it's something that's so bad, when in reality, mental health issues are actually something that we almost consider to be accepted as almost as a norm, especially considering what we are going through around the world today. No matter what, I feel that every single individual, in one way, shape, or form, is feeling the effects of everything around us, whether it's the pandemic, climate change, and also, what the issues that we also feel have developed through technology and social media. But going back to that time, it wasn't something I discussed with anyone. And I didn't really realize that through my journey of not realizing that I wasn't okay, I was going through depression, changing the way that I was. I wasn't the same person. I acted a little differently. But I thought it was just a part of growing up. I thought it was just a part of exploring life in the world. But then later on, I would say fast forwarding 10 years later, maybe even 15 years later, that was only when I had started reading more, learning more, seeing more all around me about mental health. And then at the same time, I also, dealing with the sadness, the suffering, and the journey that I had been through, I started really looking more towards what was happening to others. I started connecting more, relating more, even if what we were going through was different. Because I feel like, when it comes to mental health, we're not really here to equate who has bigger problems or what issue is more important to deal with. Because when we look at it personally as individuals, when it's happening to you, it's important. When it's happening to you, it matters. When it's happening to you, it's valid and it's real, and it's something that needs to be recognized and accepted. And it's something that needs to be universal for how we give each other that compassion, that time, and that love. So to me, whether I was looking at hunger across the world, people that were losing their homes, whether it was through natural disasters or other reasons, social injustice, whether it be violence, whether it be gender based issues, it just made me think so much more. And then going back to the Philippines, I was living in the States at that time, and going back to the Philippines really, I guess, put things into perspective. You see it around you so much more here in this country rather than being in the States. Although it doesn't discount that no matter where you go, there are communities suffering and there are communities in need. But being here, you're in the car, you see it when you're in traffic, you see it when you travel, you see it everywhere you go. And it was just this constant reminder again of what I was also feeling inside. And through connecting with friends and just kind of discussing, how we wanted to give back, and also seeing what our friends in the US were able to do through their personal journey through mental health. They started an organization called #Lunchbag, which was essentially just a group of friends a month, put $10 each together, and bought groceries to people that were homeless. And it feels almost like a basic thing that we all try to do, whether it's a birthday, a holiday, or just to really give back, especially during these hard times. And just from replicating that simple feeding program that they did there, and we did it here with friends, with family members. From there, we did it every single month. We wanted to be consistent about it. We talked about it for a while, but then once we started, we said that we wanted it to be consistent. And, like everything in life, whether it's good habits, healing, these are things that have to be formed and done consistently in order for us to really see results as well. And for us, it was just our personal commitment to wanting to give back. And I feel like hopefully tonight we'll be able to discuss more of Cora's journey, but that's really how it all began for me. And it turned into the nonprofit organization that we named after my mom, but we call it Communities Organized for Resource Allocation. And we do feeding programs, environmental programs, from coastal cleanups to mangrove plantings, and so much more. Kind of segue and connect that to our very special guest tonight. That also is one of the reasons why I'm here with you all this evening, my dear friend Kat. So we both met. Our lives intersected through Cora, but I'll allow her to share that special journey as well, because it has become one of the most meaningful friendships. You know, being able to be friends, being able to have that outside world as well. Not as much now during the pandemic, but also being able to do the work together and the mission together. And it's incredible, you know, how God and how the universe leads us all together to do these things. And we're grateful for the people that we meet. We're grateful for the friends and the family that are there to support us along the way. And now also on our mental health journey. So thank you, Kat. I love you.
Oh,
and I'll
goodness.
stop there.
I feel like I'm tearing up already.
I love you.
Yeah, I actually remember the very first time that we got connected. You were checking in because back then I was working for a fast food corporation, and you were checking in on donations that we can give for kids, right? During that time. And I was fully supportive of the advocacy of CORE about being able to use, resources that we take for granted, um, within the organization, things that might have gone to waste if we could have maximized resources that we had that we could use for the greater good. And it helped put so much smiles on kids' faces, on the volunteers' faces, and I love that. I love being able to help in that little way. But similar to Tony, but on a very different route, I was also experiencing mental health concerns, mental health issues of my own. I started off thinking that my purpose and my mission in life was to fully be on corporate. That's what my grandfather did. That's what my dad did. And having that kind of mindset that my life and my mission was to be career, quote unquote, career woman all throughout, I thought that my happiness and my fulfillment would just be there. When I got to somewhat of a peak in my career, was getting awards, recognition, I felt that there was still something definitely missing, and I fell into depression because I really let a lot of things, with regards to my well-being, go. I dropped and have had terrible relationships. Um, I was not doing well physically as well. I wasn't being mindful of what I ate, etc. And I always just thought, I'm gonna sleep when I'm dead. I'm gonna just keep pushing until I get the work done. So when I started realigning, I sought the help of a therapist, and I took a step back and I started thinking about the bigger picture. When you're dealing with depression, it's so easy for you to kind of ruminate and think about, all the things that are not right in your life, and you think that everything is just going against you, and it's hard to get up from that. So it always helps to put a different perspective, to see other ways that you can help out, other ways that can remind you, to be grateful, and have purpose in your life. And part of that was my therapist telling me that um, maybe I should look into more meaningful friendships and possibly ways to really find and build that purpose. And during that time, um, Antoinette was doing a lot of these cleanups. And I think the first time, correct me if I'm wrong, Tony, the first time that we did a cleanup together was for International Coastal Cleanup, September. And you invited me over.
Oh
And
my gosh. I don't know if I'm getting old. I can't remember what our
you
first
don't remember?
cleanup was, but I do remember, honestly, I remember our first meeting. I literally remember where I first met you, where we met, what you were even wearing. But in terms of the cleanup, I feel like we've gone through so much before that, even through the feeding
Yes,
programs. But
yes.
but I would say that one of the first major ones that we did do was the ICC, the International Coastal Cleanup, which is really exciting. It's one of those
Yeah.
most exciting ones that we.
Yeah, I remember that because I messaged you about it. I said like I want to know how I can help more like with the environment. I even said it like with the environment. It was so general. And I said you invited me to the cleanup and I was asking you about like what should I do? What should I wear? All of these things. And I was so pressured into thinking that like, I should know more about this. I should know more about the environment. I feel like I can't call myself an advocate or an environmentalist with just one cleanup. And seeing how you work and how all the volunteers within Cora they were such an amazing family. There's no judgment. Everybody was kind of just doing their own thing, volunteering, and really putting their heart into um, the efforts that we were doing. I was so inspired, and it was as if it was like magic. Like it's not as if my mental health journey was just like cured instantly, but um being able to really find that kind of fulfillment in my life. At the time I was also starting out with diving, and just connecting the dots and seeing how um, I could help make these oceans that we dive in, that we explore in, that the oceans that all these divers love and travel to. Like I can, and I see also the amount of trash, the debris, the corals that are dying, the animals, the marine animals that are suffering from what we're experiencing right now with climate change. I just kind of felt that, I all of these were being shown to me and being presented to me in a way that like I knew I could be something. I knew I could be able to contribute something. And it really helped with my mental health journey in a way that I'm always reminded that there is still hope, there is still purpose in life for as long as we keep looking at the bigger picture, keep seeing and being with friends, families, communities that also help support our well-being. Yeah.
That's a those are very touching stories, no?
Cat, love you, cat.
I feel like we talked so much.
No, it's all right. This is the beauty of Clubhouse, and I think everyone's enjoying what you're sharing. Um, but let's rewind and the. I know Tony said Planet Cora is also named after her mom. So, what exactly does Planet Cora do, or what kind of activities have you been doing at Planet Cora? And you already told us why you started it. So, yeah, Tony, please.
Sure. Actually, the other thing that I wasn't able to mention earlier is that through our journey as well, I didn't realize the link of volunteering and mental health, and how volunteering is actually one of the main ways, one of the most, I guess, therapeutic and healing ways to help anyone that is, possibly going through some mental health challenges or issues. Of course, it's not a cure, but it definitely helps. And I can attest to that. And it wasn't something that I'd actually even noticed right away and how it had begun to change my life, but it really did. And it really, as Kat mentioned, the purpose and the meaning that it brings. And it's almost like every day you feel like you're not doing enough, but it drives you to do more. It inspires you to do more. And being able to get out there and to talk to people, to meet people in different communities. And so it really started with feeding programs. As I mentioned, it started with hashtag Lunchbag from LA. And then we moved on to our coastal cleanups, which we call our Cora cleanups. So you can actually find out what we do by looking at the hashtag online, hashtag Cora cleanups. And it's a monthly activity, as well as the feeding program that we were doing, hashtag Lunchbag. Both of them were monthly. And the whole purpose was really to create a platform where volunteers could feel like they were a part of the solution. Because even for us, I feel like, for a long time I was thinking, where can I volunteer? Where can I help? Like I was looking at and following different organizations and couldn't really figure out like where could we, contribute? Where do we even begin? So to us, we wanted to find a way to really make it more accessible, more inclusive, and also replicable, so that people can actually have their own events similar to what we're doing and be a part of it as well, be a part of the actual change collectively. So that's what we really tried to do, and it translated into the to those programs. And then today, two of the most important programs that we're actually really focusing on are Clean Cities Blue Ocean. So this is an enhanced waste management system that we're working closely in partnership with the local government of Parañaque City. And this is actually supported by USAID, the United States Agency for International Development. So they're providing the funding, the expertise, all the support that we need in order to create a really good waste management system with the local government of Parañaque, because they have an amazing materials recovery facility. That's an MRF. That's actually where our trash goes after it gets picked up from our homes and businesses. But sadly, because a lot of us do not segregate, do not clean and dry and segregate our items, many times when these items get to the MRF, they're all mixed together and they end up getting sent to landfills because our waste workers can't really clean all of the waste of the world. And those are things that when we look at successful waste management systems across the world, whether it's Korea, Japan, Taiwan, the Philippines, these systems all work because we do our part at home, or they do their part at home to clean, dry, and segregate. So we're working with women champions in waste management. We're working with local communities. We're working with big businesses and brands that also want to turn over their items to us, because we do have innovation partners and recycling partners. So we're working to build a circular center that's going to ensure that the items that are brought there are sent to the proper endpoints so that they actually don't end up in the landfill and don't end up in the environment. The other amazing program that we're working with is also with women. We really believe in women empowerment, and how they really can serve as frontliners, not just in waste management and for nature, but also for climate change. So we have our Woman Grove Warriors program. And this is actually a program where we have women champions in Leyte that are actually planting mangrove seedlings. So they're nurturing the seedlings, planting them, and taking care of them as they grow. And these are actually extra special. And that particular location is very crucial because Leyte, Samar, those are the areas that were hit by Typhoon Haiyan and Yolanda. And when I really even did research after that, I was so shocked to find out that it's the strongest storm ever recorded, like literally ever. And it hit us the worst in the Philippines, resulting in thousands of lives lost. But it's not a one-time thing. When we look at the effect of climate change across the world on the Philippines in particular, our carbon footprint is really small. The effect of the individuals and what we do as a country, it's not really comparable to the effect of the greenhouse gas emissions of the top polluters of the world. But we are one of the top victims. We're in top 2 and 4 when it comes to the number of deaths and the number or the level of extreme weather that is being experienced in our country. So we're at the brunt and the forefront of the effects, but we really see women at the forefront of these solutions. And it's inspiring to see these women over there in Leyte doing their part to help fight climate change as well. And there's so much more that we're doing, but one thing that's really exciting is together with Cat, together with MindNation, we're looking forward to launching our mental health programs as well. So that's something that we really look forward to, and I feel like we grew to this place organically, even throughout the conversation and the journey, both on our ends. Kat and I weren't really, our mental health journey wasn't something that was parallel before. It was actually more personal on each of our ends. And it was more of the work for Cora that was more parallel. But now it's pretty amazing to see that it's also coming together now as well. And I'd like to turn it over to Kat for to continue as well, to talk a little bit more about, I guess, mental health and what they do as well, since it's something that also inspires us, and we've learned so much from her too, and also from the experiences and the talks that we've done with MindNation and Cora.
Thanks, Tony. I Oh my goodness, it's so hard to follow through on something like that. It's amazing.
I'm sorry.
But I am speechless. But with regards to MindNation, MindNation is a mental health and well-being organization. We founded it in 2019, pre-pandemic. Um, when we started talking about looking for more ways to make mental health care more accessible and affordable than for Filipinos. And I we started with offering these services B2B through organizations and companies by having mental health services available to employees. We have done so much great research on the mental health state of employees during the pandemic as well through our insights team, and have learned that 1 in 3 employees suffer from mental health issues during the pandemic. And unfortunately, this is when we are talking about the mental health landscape. The mental health problem is not a new thing. Even before the pandemic, we suicide is one of the top three leading causes of death, not only in the Philippines, but globally. And so many people suffer from mental health concerns. 2 out of 5 um, people globally suffer from mental health concerns. And I personally realized and understood as well the barriers into accessing these services. When I was going through my depression, I found it very difficult to connect with a psychologist, much more someone that I really could pour my heart out to and can help me. There's a limited number of experts here in the Philippines. And of course, like, as much as you want to try all these different apps, all these different experts globally that are available globally as well, they simply don't understand the Philippine context of family, relationships, etc. And at the same time, I realized and I learned that mental health care was then not part of employee assistance programs within organizations, and they were not covered by our healthcare cards and HMOs. It's not part of employee benefit because the traditional way that we used to think about mental health, because it's so highly stigmatized, is that it's a personal problem that leaders and organizations should have nothing to do with. What they failed to realize and what we're learning now, even with our research, especially with our research, is that it's highly connected. The more that you feel mentally well at work, have you feel like you have a sense of purpose, you're balanced, you're able to have better relationships with your colleagues, with your bosses, you're able to contribute better, become more productive, and this is all the more important in the world that we're facing now. And that's those are the things that we really try to drive within the organization when we talk to clients that want to have MindNation as their partner. MindNation offers psychologists, psychiatrists, well-being coaches. We do pulse surveys to check in on employees. We have free mental health resources on our website if they want to do worksheets, if they want to learn more about the mental health landscape, certain issues like suicide or depression. And we're we've in the last year we opened this up to individuals as well, offering mental health services and therapy sessions by booking on Facebook or through email. So now we are trying to make it all the more accessible by having our services on the Good Work app. We're also expanding rapidly. We're now open to organizations within Asia and the Middle East. So it's been an amazing journey with my partners, with my team members in MindNation, and I feel I've never felt so much more fulfilled than I was before. And it's all thanks to the journey that I was in, and all thanks to the people that inspire me, like Tony, my team members, and my friends that continue to support the advocacy as well.
Wow, thanks, Kat, for doing all those. And I also checked the website of MindNation. I saw you have a calculator there on the cost of mental health issues on employees. Because, for those who are not familiar with Makati House, we are a professional network. So we also have a lot of business owners here, managers as well, HR professionals, and that's a good reference for your website, right? um yeah, and that's the it's very good. It's very refreshing to see somebody, very uh, working very passionately in mental health. Like, even I myself, around my friends and family, um, uh, I have relatives also who are suffering from mental health issues, and um, like a decade ago or 5 years ago, it's something that was never talked about. um, so how big of a concern is this in the Philippines? Like, I know there's a lot of stigma against or towards people with mental health, or those who are having issues. Let me ask something for you, Kat, and then maybe Tony as well. Um, what are the signs of trouble that actually, let me rephrase that. What can the average person do to eliminate the stigma,
Right.
Cat?
Part of the biggest thing about eliminating stigma about mental health is to really actively be talking about it. But even if you're not ready to talk about it, like Tony said, we were both going through very different mental health journeys, and before we kind of did our own thing. It was only later on in our friendship when we started opening up about each other's mental health. And when we did, and when I do open up to people about my mental health journey, it makes me feel more connected. It helps people understand that it's okay to talk about these things. It's okay to talk about depression. It's okay to have negative emotions, or as they say, it's okay not to be okay, because it's a completely normal thing. We're all humans with wide range of emotions, from happy to ecstatic to sad and depressed. We all experience this. We have different ways of coping, and some are far more resilient than others, but all of these require understanding and empathy. The key thing for you to be able to start on your mental health journey and eventually help lessen the stigma on mental health is to also be aware with your own feelings, and be honest with them, and be able to sit with your emotions, even the negative ones, and really practice that empathy and then that kindness to yourself. When you're able to be honest with your emotions and honest with your state of mental health, and open to seeking help and seeking the help of experts, and actually making change, or you know starting that change within yourself, to change lifestyle, change better habits, you start to ease up and start to be able to open up about these things to the people closest to you. And it's important to be able to talk about this as well, because mental health is not a solo journey. It's not just the job of one person alone. Like, if it's your mental health, it's a solo journey. It requires each and every one around you. It requires a support system, the support of your leaders in your organization, the support of your family, the loved ones, friends. And all of these play an important role in how they remind you of better habits, how they help you with accountability. So being able to talk about it openly, or find friends or community members, maybe also within Clubhouse. I see, and I'm actually part of many rooms that just do therapy. They just talk about therapy. They just talk about mental health concerns. Being able to expose yourself to these kinds of things can help lessen the stigma towards mental health. Tony, you want to add?
Sure, thank you, Kat. That was amazing. Um, yes, I couldn't agree more. I echo everything that Kat said. And the thing is, I feel like for a lot of us, before we really start talking about it, because sometimes I look back um, during the times that I wasn't open yet or not even aware. So I always have these stages that I talk about of how I healed before. And it's funny because even when I had those personal stages, I didn't know that there was the different stages of healing and all of that. And I learned it along the way, but at least it was empowering for me to see that, oh, wow, I went through exactly what it is that they say everybody goes through and how people heal. And so for me, I guess, it started with denial, the change in behavior, the loss of inspiration, hopelessness, isolation. But then after that, the healing came with acceptance, with understanding. And then, of course, with understanding, it's the proactive healing. But more than anything, it's very surprising how empowering it can feel to finally talk about it and finally be open about it, because um, I understand that it can seem scary, it can seem daunting, it can seem intimidating to think that, oh my gosh, people might judge you or might think that something's wrong with you or whatever it may be, because that's the stigma that was built before, which is so wrong. And then when I finally was open about it, it was actually also work with the World Health Organization. So when they were doing the campaign for mental health, they actually had asked me would I be okay with discussing it more and being open about it. At the same time, also learning more and hopefully empower others to talk about it more, because the campaign was actually hashtag Let's Talk, because talking about it is really one of the greatest ways to heal. So, of course, no matter what, it has to be someone you trust. You have to choose the right person. And at the end of the day, though, there's always the professionals, and it doesn't have to be face to face. It can be anonymous, it can be online, but really being able to talk about it and being open about it was one of the greatest things that helped me feel better and helped me heal. It was almost like it removed almost half the battle, because now it's like when you're going through something, you can turn to someone that you know that might understand you. And of course, and that's another, another conversation, being also cautious and careful of the people that we share what we are going through, because we don't want to affect them either too much, because there are people that are also that have a lot of empathy and have um, highly sensitive personalities that also could be affected. So it's also finding the right people to have these conversations with, being able to communicate in a healthy way. And that's why I think really learning from the experts, no matter what, always really consulting with professionals is always the best way to go. And doing research and learning more from valid sources like the World Health Organization, and of course groups like MindNation and organizations like MindNation. And that's it. I just hope that I can't. I don't know what to say about how can we really lessen the stigma, but maybe really is it's to talk about it more, and just for us to really believe in our hearts that it's going to help us and it's going to help empower others as well when they hear your story. I feel like that's one of the most powerful things too, because for me, that's how I also got the courage to speak about it more, hearing about other people's stories. So you never know who you are also inspiring. No matter what, your journey will always empower someone else. And don't discount yourself, don't underestimate yourself, because I've been inspired by different stories from different people, from friends to strangers to people I've met in communities. So your story will help empower others and also will help you heal. And yeah.
Yes, thanks, Tony, and yeah, you mentioned empathy. We were talking about that here in Makati House last night, and I can resonate with that a lot. You know, everybody can be a like even in the workplace, right? You can have a much better workplace if everybody was had had more empathy or practiced empathy more. Not just when you're communicating with your colleagues, but also to your customers, because that's gonna help. Like you can put yourself in the shoes of your customers, find out what's troubling them if you want to help them. um so anyway, we are more than half an hour past uh the hour, so we'll take a quick break. But before we take a quick break, Jen, do you have anything to add, or um a message?
I just cannot find the right word to say how much I am so inspired, with our conversation this afternoon. I mean, evening your time and morning with our friends' time. But I like it when Antoinette said empowering others to talk about it and listening. It's sometimes we were discussing this as well, with JP yesterday with some of our friends in Makati House, and we're talking about hot point, where to go, when you feel like nobody is listening, or who am I going to trust to? But you guys, it's just like you're opening a door for us, like Cat, having this professional organization that, sometimes we said like, oh, I cannot give you the right advice because I'm not professional. I don't know, I don't know what to do. Or some people would say, I might be wrong, and some people might like think that, what are you talking about? you're not this good enough. But then for you, Kat, to have this kind of organization is, to me, it's like a big massive door. And I really really like to say, that we're looking forward to your organization to grow more, especially in the Philippines. And to Tony, look, if your mom is here or ever wherever she is up there looking at you, I'm sure she's so proud of what you're doing now. So
Thank
yes,
you so much. That's so
Thank
it
you,
kind
is.
of
It
Kat.
is. I
you.
mean,
Thank
like,
you.
you know, I'm not very professional, but I'm just looking at in a normal human being's perspective. Like, not everybody can do what you are doing. You know, we don't have that start or that drive that you do, but you really do inspire us, and I'm sure a lot of our listener, can resonate with your stories.
The
So yeah.
truth is, Jen, like anybody anybody can do this, anybody can, and I think that's the reason why Antoinette and I are so vocal about it, and that's the reason also why Cora, as communities allocated for resource allocation, we really want to empower more and more people to be able to make a difference, and we really couldn't do the work that we do without everybody else. So it's completely feasible to be able to do what we do and maybe even
That's so amazing. Shall we do the reset, JP?
Yes, so let's go on a quick break. And before we reset the room, for those tuned in that have questions to our guests or something to share with everyone, we will be opening up the stage later. You can join us on Clubhouse. Simply go to https:// radio.cc/mh to install the app and find the club room. You may also write in your questions through the back channel feature of Clubhouse. And for those on Facebook, Twitter, and YouTube, you may write your questions in the comments. We have received some questions and some greetings from the fans of Tony and new fans of Kat from all
haha.
over the Philippines. So we'll be back. We'll be back in a minute. Stay tuned. Thank you for staying here with us.
Welcome to Makati House, a professional network for Filipinos helping Filipinos. We are spreading awareness of World Mental Health Day happening tomorrow, October 10th. Our topic tonight is mental health and how volunteerism can help with mental well being. We're joined by actress, singer, and Planet CORA founder Antoinette Tause and mental health leader Kat Triviño of MindNation. This event is being recorded and streamed live to other platforms. Find us on Facebook, Instagram, YouTube, and Twitter, and listen to our past discussions on Apple Podcasts and Spotify.
Okay, so we're back. It is now we're starting to run out of time. And yeah, like Jan said, there's not gonna be enough time for tonight to cover all the things that we prepared for. Um, so Jan, where are we on the list?
Where are we on the list? Do we have a list? No, we don't have a list. List is not enough.
Okay, let me pick one. Let me pick one random one from our list. Um, so how does somebody know if they need help? Or is there some kind of self help that we can do? And follow up question to that is, what are the signs of trouble one should look out for family, friends, or co-workers? Kat, can you share something?
Yeah, I think I can take this on. I think, well, okay, number one, to be very, very clear, I am not a mental health professional, meaning I'm not a psychologist or a psychiatrist. So everything that I will share with you is because of either the research of MindNation or my personal journey with mental health. Okay, my disclosure. But when you're thinking about like the right time to seek therapy or right time to seek help, I personally really want to be able to advocate that anyone and everyone should actually regularly check in with a mental health expert when they can. It's completely healthy and completely normal to just check in, even if you don't feel like you're you're not at your best. I think that's really a part of where the stigma lies when we think that we only need to seek help or go to therapy when things are at their worst. And the worst meaning, or like the too late, quote unquote, would mean when you're already a harm to yourself or to others, when you feel like whatever you're feeling, the emotions are already debilitating. It's already dealing, it's already interfering with your day-to-day life, with the habits and things that used to make you feel happy and ecstatic or normal, even the little things like being able to get up for bed in the morning, or talk to someone properly and have a healthy discourse. All of these things are connected to our overall well-being, and it's important to reach out to the experts for that. If you're not open, you can always reach out to coaches, close family, and friends that you trust. But at the core of it is really being able to regularly check in with yourself. Uh, a big part of mindfulness, or of mental health, is being mindful of how we feel. And I shared that earlier. That's a way to also release stigma within yourself when you're aware about these emotions. Emotions should not be, even the negative ones should not be treated as something that we should ignore. We can't push it under the rug. When we think about, mental health, we want to think that we always need to be positive. We always need to be at our best and most productive state. But it's not always the case. Life is filled with difficulties. Life is filled with challenges, curveballs, pandemic, and it's completely normal to not feel your best. So being able to check in and ask yourself how you're feeling, how healthy, or how well you're coping, especially during this pandemic, is important. And we have the experts for that. MindNation is here for that. There are so many people and organizations and communities that are able to give you the help that you need. So by constantly checking in and asking yourself how you're doing, and in any case, understanding that there's never too early a time to seek help of a psychologist, seek help of an expert, is really part of how we can better take care of our overall well-being.
I'd also like to chime in quick after that. Oh my gosh,
Go.
Kat, grab it. It's so nice having this time with you and being able to have these conversations. Na-inspire ako and really hoping we can have more of these. And I just wanted to add to what she said, wherein, sadness and, having certain feelings and feeling low, it's a part of life, and crying sometimes when something happens. But the experts do say that if it's something that's recurring and that lasts more than 2 weeks, and you just feel like even though the months are passing, your emotions aren't changing, they might even be getting worse, it's really important to seek professional help. But more than anything, when it comes to professional help or even just the path to healing, a lot of what I've seen, a lot of what I've heard, and also what I've experienced is they really say that there's no one specific formula. Of course, first and foremost, seek professional help, talk to a professional. But even in terms of that, sometimes the first person you talk to might not work for you, but that doesn't mean that therapy or seeking help is not the right thing to do. For some people, it's a journey. For some people, they try different ones or different ways of healing, different ways of therapy. And, it's really also a journey. Healing is a journey. And I feel like even for each of us, it isn't something that we should put pressure on ourselves, because for some people, their healing might even happen in a few months, in a few years. And for some people, these feelings might actually be something that might be lifelong. I personally feel that mine, it's probably a lifelong journey for me, but it's okay. And I've learned to manage. The journey is definitely not over for me. I still struggle a lot. I have difficult days. Kat knows about that, and a lot of it is also because I do work a lot, and that's not good. We always have to balance our lives and the pressure of everything around us, the pandemic. But all I have to say is make sure that you're also kind to yourself in your healing journey. Once again, there's not one way to do it, and it takes time and it takes consistency. But no matter what, just keep going and know that you're not alone. From a lot of us having similar feelings, different feelings, but still in the same realm, to also not always finding the right pathway to heal right away, but it's okay. Once again, it's okay.
Wow. I like that word. You say it's okay. Sometimes you feel like, what is wrong with me? And people would say to you, don't worry about it. Everything is okay. But, to have somebody to reassure you that, you know, you've got help. It's okay. We're here to support you. We're listening. I think that's a lot. And then you're going to add, professional help that is affordable. Because we're always like talking in the Philippines, like, when we're thinking about getting professional help, it's too expensive, you know. And if you're looking for gurus, um, personal trainers, life coach, who are the legit one, who are the fakes one, you know. And to be able to have you guys in here talking about this, it's a very good thing. It's a very, like I always said, an eye opener. And so yeah, thank you very much for sharing that, Tony and Kat. Back to you, JP.
Yes, thank you so much for sharing. We really appreciate it, and keeping the discussion going because, like we said from the start, it's not talked about enough. So here we are talking about it, making we're taking action. So thank you for that. So I want to rewind a bit, or take a step back and look at the bigger picture as well with mental health. So I want to ask, uh, uh, maybe Tony first or Kat. I don't know who wants to go first. So I want to ask, what are some of the common mental health disorders that we should know about? I know we mentioned depression. Um, uh, are there others like maybe eating disorders or addiction? Because that's something, in policy making, or what our government or our health, our government health system that should be able to provide service, right, for everyone. What kind of services that we should, our healthcare system should provide for mental, in terms of mental health. So yeah, that's what I wanted to ask. Like, what are the other health mental health disorders that we should know about?
I can take this on. The most common mental health concerns. I speak for both the Philippines and also information from the World Health Organization, is depression and anxiety. There are so many people that are dealing with anxiety, from mild to more severe generalized anxiety disorders. I can't speak about the more physical concerns like eating disorders and all of those things, but I would like to say that when dealing with mental health, they're all interconnected, intersectional rin siya, just like how we also talk about climate change and the environment. There's so many things that affect our physical body, our physical illnesses and concerns when we're talking about mental health. Because when we're talking about mental health, we talk about not just one dimension on feelings. It's also connected to a couple of well-being dimensions. Like, um, so you have the physical with the fitness, nutrition, and sleep and hydration, but also being able to have good access to sleep. Uh, Sleep concerns like insomnia are things and concerns that you can also reach out to a psychologist for so that they can help you develop better habits because um, a lot of sleeping concerns are connected with overthinking, with thoughts that ruminate, that avoid us from getting a good night's sleep. There's also financial stability and security that affect our mental well-being. At the same time, you also have the social well-being where connection to family and friends, our relationship concerns, anxieties and attachment problems and issues are also connected with our mental health and our ability to have great and healthy relationships with others. And then you also have cultural well-being, knowing and finding that sense of purpose. There might be some connection to anxiety and depression, something that I dealt with, but also um, things that surround your thoughts on faith, on spirituality, purpose in your role in your career, where you want to be in life, what your purpose and meaning in life is. Those things are also concerns or dimensions in well-being that we need to be talking about when we're talking about the holisticity of mental health. And Tony can also talk about how the environment is interconnected with a lot of different social issues as well. So it's not to say that we should solely, the government or organizations should solely focus on anxiety, depression, and suicide. The numbers are alarming. It's just that everything is interconnected. And it really takes empathy and understanding and that an understanding of holisticity and balance for us to really get to tackle the concerns of our psychological well-being. Tony, you want to add to that?
Sure. Actually, it was really amazing how you put all that into perspective. I was going to say earlier, for you to take that question because I know you have said that you are not an expert, but at the end of the day, I know that you also have a lot of experience. So even with that, you know what the common issues are when it comes to mental health in the Philippines and across the world. I myself also come from my personal perspectives, but when we speak of mental health in the environment, a lot of people actually don't realize and also are shocked to find out that the environment, the health of the environment, the pollution around us, factors around us can actually affect our mental health. And one of them that is actually always being highlighted is air pollution. So imagine that we don't really realize how air pollution in itself is affecting our mental health. And this is a common problem across the world. They talk about the relation between high traffic related air pollution and anxiety levels. And these are actually studies made by the United Nations Environment Program, the World Health Organization as well. And so on. There are so many more implications of how pollution affects our mental health as well. And of course, when we talk about climate anxiety, it's really sad to think that we even have these words nowadays: eco anxiety, climate anxiety. And I feel that the one thing that I'd also like to share about that is I understand, first of all, wow, because I go through it too as someone that looks at the facts, that reads the statistics, is working also closely with communities. It can be scary. It can be horrifying to think of what is really in store. It can be scary to think of what's happening all around the world: forest fires everywhere, glaciers and ice caps melting. And of course, sea level rise. We're seeing that in our own country. But the one thing that we do say is no matter what, we are doing what we can and we're in this together. And there's no perfect way to make a difference. All we can do is do our part. And that in itself is powerful. Sometimes we think when we just do one little thing, it doesn't matter, but it really does. And one of the perfect examples is really talking about litter. Like, imagine if 8 billion people threw a piece of trash on the ground, that's 8 billion pieces of trash. But if 8 billion people picked up a piece of trash, imagine that's 8 billion pieces picked up or prevented from going out there. So, really looking at how our individual actions really, truly still are powerful. And all we can really think about is what we can control. Even when it comes to the items that we use, whether it's single use plastics, and feeling like, oh my gosh, what are we going to do with this? Or even the plastics in our life, or certain items that sometimes we don't know what to do. How do we dispose of it? We do what we can in our control, to reuse items that we can, to dispose of things properly. But that's the best we can do. We work towards it. We support pledges. We support policies that need help. But whatever it may be, as long as we do one little thing every day, even just being kind to another person or to a living being, a living creature, that in itself is already making a difference. So, really focusing on the light, focusing on the things that we can control, focusing on the things that bring healing to others and bring healing to the world, because that's also related to what we mentioned earlier, how volunteerism is a form of therapy and is a form of healing, because we don't realize that as we strive to kind of, I guess, help other people, whether it's to help feed the hungry or be there for someone going through mental health issues or trying to help the environment, these things also have an effect on our mental health as well. So as we're trying to help heal others, we're also healing ourselves in the process. So those are just some of the other realizations and learnings that I've had through our experiences, and that I hope other people can also experience and discover on their own journey as well. And I'm a late bloomer. That's another thing that I always want to tell everybody. From sustainability to mental health, I learned everything at a way later age than a lot of people nowadays, even than Kat. Like if I compare my journey to Kat, she's doing it at a much younger age. I turned 40 this year, and that's something that I actually openly share with people, because I don't want anyone to ever think that they're too young or too old or too late to make a difference. You're never too late to do anything, and the best time to start is always now.
Yeah, thanks, Tony. You you say a lot of things, and then that you're saying a lot of things that resonate a lot to me. And also because I produced the the show here on Makati House about sustainability, so I can relate a lot. The other day I was just reading about the study published on Nature magazine about climate change anxiety experienced by teens, and the Philippines and India get a special mention because in the survey, a lot of um, young people are worried about climate change and they feel like they can't do anything about it. And yeah, so um, and speaking of anxiety, climate change anxiety, there are a lot of anxieties that we can talk about in future discussions. So I recommend everyone to follow Makati House on Clubhouse and wherever you're tuned in right now. We'll cover all the topics of anxiety that we can. We were just thinking about what we should cover, like loss of a loved one or somebody close to them, the stress at work, um, the pandemic, um, uh, raising a child rearing, pregnancy, uh, lots and lots of other things, and including climate change anxiety, because you know, it also got me worried. I want to go back really quick to climate change, because when I looked at the IPCC report that we're gonna cover in a future episode, um, uh, when you look at the atlas in 10-20 years, with the rate that we are emitting greenhouse gases into the atmosphere, the sea level will rise. So the the western part of Bulacan will be underwater, and even Mall of Asia will be underwater. Like even now, right? Just a few days of rain or some wind, you can see parts um uh of the area in Mall of Asia gets flooded, um, and those places are high at risk. And Tony, you mentioned also parts of Parañaque, and those are at risk as well. Um, so i for somebody who's gonna be for people who live near those areas, there's a good chance for them to be, anxious about it, and that's gonna scare them because you have about 20 years, or if you don't want to move, right, if you've lived there your whole life, you have everything there, your friends, family, and everything you have is in that place, and you're gonna lose it. That's definitely gonna scare you and make you anxious. um so yeah, Jen, what's our next thing on the list? We're getting close
JP,
to.
I actually want
Yeah.
to add to that. There's actually a recent study, global study that um, announced or shared that uh, Philippines was actually one of the top countries where the youth, the children in the Philippines are the most stressed by climate crisis. So 80 from the 10,000 people that they surveyed, 89% felt that they were worried and anxious versus indifferent or excited or hopeful even because of what you had mentioned. They felt that there was nothing that they can do, and it's driven all the more now because of the pandemic. They're just at home versus in the past where, for example, Antoinette and I would have these coastal cleanups regularly every month, and there would be so much youth volunteers that come in regularly and dedicate their time and efforts with us, from students, from the I think the youngest one that we have for volunteer was, is she 4? Is Lexus 4, Antoinette?
She was that young before. She actually grew up already. I think now she's probably 7 or 8, or maybe 8 or 9. But
Oh
yes, they
my
grew
god.
up with us.
Oh my goodness, the Cora babies. So understanding that from the study that came out just this year, that there's so many kids and so much people that are dealing with this eco anxiety. It's all the more important to talk about the things that they can do at home, things that they can do to volunteer virtually, to talk about and raise awareness, because the youth are all the more engaged, and they're more driven by purpose and not by a status. It's a huge part of the drive towards climate action and even mental health.
Right. I was reading the same article, or same paper, Cat. Yeah. So speaking of yeah, anxiety and climate change, we're getting closer to opening the floor to those who have questions or have something to share. But before we get to that, Cat, uh, you also mentioned earlier, before we opened the room, that MindNation is doing a promotion, a 10/10 sale, and maybe Tony, are you looking for volunteers? Maybe you can say something. So let's Kat, why don't you go first, and then maybe Tony for your call
Sure.
for volunteers.
Sure. So, as mentioned, Mind Nation is really actively campaigning for to normalize the conversation around mental health, and this is actually even the theme of World Mental Health Day, to be able to talk about it, to talk about uh, the issues, to talk about the challenges, and really develop more empathy for ourselves and each other. So, in line with that, you know how these 9/9, 10/10, these special days are huge within the e-commerce industry. We decided to also kickstart our own, and this was in partnership with our creative agency Propel, and also with um, lifestyle app Good Work. Our services, our special services, from anti-anxiety, deep sleep, stress reliever, depression healing, they're all at slashed off prices, from the regular price of 2,500 per session for a psychologist. It's now at 1,010 pesos per hour, and they can help you deal and start off your mental health journey and talk about these different issues that you want. You can book as many sessions as you can, and you can have them scheduled throughout the month. It's even without the sale. I hope that people can check out and spread more awareness on not only the campaign but the advocacy that we're driving towards mental health. It's we want to also and look forward also to partnering with organizations. We're going to be having um, an amazing program very soon with Cora as well on how to make mental health more accessible to those that also can't afford. I know Jen mentioned that earlier. Those are really the roadblocks into be able to seeking therapy. It's not that affordable just yet. So we really look forward to normalizing, getting more experts in, more volunteers in to make the mental health journey something that's normal, something that people will be willing and open to investing in.
Thank you, Kat. That's so amazing. And for Cora, there are a number of different opportunities. So, all of our programs are still continuing, and mainly in an online format. So, from our webinars, the topics are from Clean Cities Blue Ocean, for plastic pollution, to JET, which is the just energy transition that we're doing with Oxfam. And those are webinars that you can check out on our social media pages to learn more about them and how you can join. And then at the same time, we're also still hosting donations for community pantries and feeding programs, also for cleanups, supporting our Bakawan warriors that are actually helping clean Manila Bay. So they continue to do that in that area, and we support them and we help them. They're the ones that we actually clean with. So we call them our frontliners of nature. So you can donate to support the work that they are doing as well, and also our Woman Grove Warriors program. So there's a number of ways that you can help. You can adopt a seedling to be cared for by the women of Leyte, the Woman Grove Warriors. You can also dedicate a mangrove seedling to someone special and watch your love grow. We also had a special Jungkook dedication mangrove seedlings for his birthday from BTS, and this was actually because of one of their main fan groups, Golden Alliance, that approached us to help do this in honor of their idol Jungkook. So if you are a fan of BTS, kung army po kayo, you can also dedicate a mangrove to be planted in his specific sanctuary. And I'm also still open for dedications. My birthday passed in August, but you can dedicate a mangrove to me as well. But no matter who it is, the point is you're helping make a difference and you're empowering the lives of these women. We're also going to be announcing very soon how we can start taking not just your plastic waste, but different forms of waste through our Clean Cities Blue Ocean program with USAID. And you can learn about how you can support all of these on our social media pages. Our handles are at Planet Cora and at We Are Cora. That's WEARECORA. And you can also go to our website. All the information is there, www.wearecora.org. That's WEARECORA.org.
Yes. Yeah, I recommend everyone to check out the Clean Cities Blue Oceans webinar. I watched it. It's a very good program, and it was a very fun 1 hour or so watch, and I learned a lot as well. So I recommend everyone to check it out. Jen, is there something? Yeah.
Yes, very quickly. Yeah, I like the idea of dedicate a mangrove tree to your loved ones. And I think that's a very good thing for us, especially here in Clubhouse as well, to reach out to our friends overseas. Because sometimes we're wondering, what is there something special? What any special present that we can give or dedicate to our loved ones? Or it's even a form of a therapy or to remember somebody that we love the most, you know. I've done this before with a friend of mine um, who lives in Israel, and I don't know the right present or not present, but to comfort the family. So what I did is I dedicate, I um a tree, I plant a tree, in her name, and I've got this. The mom called me and she was like crying and she said like I feel like my daughter is there and she's still alive, you know, and yeah, it's amazing. Whatever you're doing, I'm so impressed. So maybe we're looking for a present for our president, no, our big brother in Clubhouse, Makati House, HB. So yeah, I think we're looking forward to
Hi, how are you?
support you. One tree for HB there on his
Oh, wow.
birthday.
Thank you so much. That's
Let's
so
do
Yes,
that.
beautiful. Thank you.
and
Um,
Oh, sorry, HB. What? Very quick.
Jen, finish up, and
Yeah,
then
very quick
I'll be after.
question for Kat. We were talking about the individual battling mental health as well. But very quickly, I just like to ask you about the people, who are supporting, or the loved ones of these people who are suffering with mental health. Can they also reach out to your organization, or even to Antoinette? Like, for example, I have, a daughter or a son, and, I don't know how to deal with them. Can I reach out to you guys as well?
Yeah, yeah, of course. Our chat for Mind Nation is actually open 24/7, and it's manned by mental health first aiders that are able to take you through anything under the sun. Anything, if you ever just need a friend to talk, or you want to book a consultation with a psychologist or a psychiatrist, you can reach out to them. It's at facebook.com/mindnation or on Instagram at mindnation. And we can take you through that journey, how to be um, in that space where you can support your loved one, your child, your partner, your sibling during times of distress. It's very important that you are able to also check in within yourself and see if you're in the space for that. You can't pour from an empty cup. If you're not in the space, and if you don't have that kind of empathy and love for yourself as well, it's going to be so much harder to be there for others. So if you can reach out to the experts and ask them to help you, number one, check in with yourself if you're in the space mentally and emotionally for supporting others. And number two, they can also provide you tips on how to help your loved ones cope. Most of the time, what these people who are going through something need is really the feeling and the presence of someone that cares for them. When we're when we're in this space where you feel like things are falling on you, and you feel like it's hopeless, it can be very helpful to have a listening ear, someone that's just present. And it's important that when these people are presenting themselves, that they're willing to help, you're able to follow through on that as well and really give your full undivided attention and care to them. So yeah, you can reach out to us.
Thanks, Kat, for offering that. I have a question for Tony. So for those who have listened or who were in our previous discussions about sikaws or dugongs, um, is it possible to dedicate a mangrove tree to a lonely dugong in Dumaguete? Is that part of the mangrove forests that you're supporting?
Um, I'm not quite sure exactly what you mean, but of course, if you would like to dedicate a mangrove tree to any cause at all, we could definitely do that. In terms of specific locations, we are in Leyte right now, with more areas sprouting soon. That's how we like to call it. But in terms of dugongs, I feel like there are a lot of conservation efforts around the country that are actually doing an amazing job of protecting this endangered species that's actually very special to the Philippines in particular. So whether you're planting a mangrove, or dedicating a mangrove, or supporting those conservation efforts, it's really quite important, and it is also interconnected, because these ecosystems are all related. So from mangrove trees to coral reefs to seagrass beds, and these are the areas that dugongs actually frequent as well, especially seagrass beds. So these are areas that actually thrive with the presence of more mangroves too. So most definitely, I feel like in areas where this species is really found, the presence of mangroves definitely also helps protect and conserve them.
All right. All right. Let's discuss offline, Tony. I know we have a lot to we have a lot of projects that we can do together.
Yes.
Mm. All right. So I know we're over time. Can we spare maybe 20 more minutes, Tony and Kat?
Um,
Sure, that should, I guess that should be okay.
Oh,
Okay.
JP,
Yeah, HB.
do you
Yeah.
mind if, because like we're opening it for questions, right? Um, I Hey Antoinette and Kat, thank you very much for joining us in Makati House. It's a privilege having you guys here and learning about the causes, your causes and your missions, with your particular organizations, and we really appreciate you here. Again, I just want to thank you on behalf of the whole Makati House.
Thank you so much. We're so grateful to have been able to join you tonight.
JP.
Yes, okay. So we'll take a quick break and set up the stage for those who has questions and has something to share. So please stay tuned. Especially those who are also listening on or watching on Facebook, YouTube, and Twitter. So please stand by.
Welcome to Makati House, a professional network for Filipinos helping Filipinos. We are spreading awareness of World Mental Health Day happening tomorrow, October 10th. Our topic tonight is mental health and how volunteerism can help with mental well being. We're joined by actress, singer, and Planet CORA founder Antoinette Tause and mental health leader Cat Triviño of MindNation. This event is being recorded and streamed live to other platforms. Find us on Facebook, Instagram, YouTube, and Twitter, and listen to our past discussions on Apple Podcasts and Spotify.
Oh, sorry. Okay, there. I'm no longer muted. So we have one question written in. Uh, Bea, can you dictate the question from our lucky winner?
Okay, give me a second. Uh, so this is from Mitch De Leon. He's right in the audience, the one with the pink background. So his question is: there are lots of fake gurus, mental wellness, and coaches on Clubhouse. What are the important things to check on Clubhouse prior to engage with, in terms of safety and professional?
Sorry, Bea, can you repeat that?
So, uh, I'm sorry, my dogs are very noisy.
Okay, I can do it, Bea. So there are lots of fake gurus, mental wellness, and coaches on Clubhouse. What are important things to check on Clubhouse prior to engage with safely and professionally?
Right. Actually, this is something we'd noticed as well. The surge of life coaches and well-being coaches, because, well, with life coaches and well-being coaches, you don't need to be clinically trained, and a lot of these people, they really come from their own personal experiences, and it's not to say that they're fake, right? It's completely valid whatever they're going through, and sometimes the ideas and the advice that they give are work for other people as well of a similar mindset. The most important thing to be very careful of when you're listening to things like to advice or to things over Clubhouse or other sources is to be mindful of how you're feeling about this advice, how you're feeling about uh, the the things that they're sharing. Or is it making you feel uncomfortable? Is it uh, talking about toxic positivity where you feel like, I feel like this isn't going to do me any good because I'm not addressing my mental health. They're telling me to just think of the positives, just think of the things moving forward. Life coaches, well-being coaches, all these mental health gurus, especially the ones that are not trained, the focus is usually on the future, whereas psychologists, psychiatrists are trained to really dig deep and talk about things of the past and how and why feelings are or the way that you cope relate to things that you've experienced in the past, like trauma, specific incidents, etc. So when you're listening to them, take it with a grain of salt. There are good advices. They're very good and helpful with looking into the more positive things, developing better habits, building better habits. They can help you find motivation. They can help you find purpose. And if you're feeling a certain way, it's great to hear words of affirmation, things that make you feel confident and secure. But at the same time, I would highly recommend if you really feel like there's something wrong, if you really feel like you need to check in on your mental health, go do due diligence and seek the help of an expert. Book a session. Invest in your well-being. It's really going to be worth it.
Thanks for that, Kat. So we're really running out of time. Let's have Kiara, Andrea, who just came up, and also April, and then also Happy Pinay Project. So Kiara, you're up.
Yes, hi, good evening, everyone. So, my question is, what are your habits or mindfulness practices that you can suggest to us that we can easily do at home in this trying time of the pandemic? Say, when a person is grieving or experiencing occasional panic attacks or anxiety. Thank you.
Tony, I think you can start with this.
That's so funny. I was actually gonna say maybe I could start and then you could give a little bit more of your expert advice as well,
Go.
based on your experience. But honestly, for me, I'll start with the basics kasi yun na nga. Mine are really more the simple tricks. And the first thing is, naririnig natin parati to. We hear this from a lot of people everywhere when we're having a moment, but it's really simple, just to breathe. So first, don't forget to breathe. Really, kind of just bring yourself back to reality. I personally, because I have a tendency to get lost in my thoughts. So really, kind of just taking control of the moment and saying, okay, all right, breathe. Everything is going to be okay. Control yourself. Calm down. Relax. There are solutions to this, and it's going to be okay. Because sometimes we just really have a tendency to spiral and you know nga, panic. But breathing and inhaling and exhaling, just that simple act in itself, um, helps a well it your level you're experiencing, what Kat's been mentioning since early, and what professionals always really recommend is having your own practice, really starting the day properly. I, you know, I I do the
Antoinette, I think you're breaking.
our progress, and as I mentioned, hello. Oh no.
That's better.
Am I
Uh,
cutting out? Oh, there you go. So having a healthy routine and also being able to balance your life. So another thing that I've realized, not just going into the panic attacks itself, but really looking at maybe some underlying causes that could be causing it, that you don't realize that what led you to that point. And a lot of things that I never thought of before was not having enough sleep, not resting enough, not eating properly or eating on time, or eating the right kind of healthy foods for yourself, not working out. So, actually, and the opposite, doing all these other activities to help balance out your life, balance out your physical and mental health, also helps avoid getting to that point. But that's really more of on more of the basic ways that I can think of. But when it comes to the bigger issues, a lot of times it's something that just can't be solved with a simple breathing exercise. It can just be solved with simple things, and it really needs professional help. And that's not a bad thing. that's definitely not a bad thing. And it's something that does have a solution, and it begins with seeking professional help. And I guess I'd like to turn that over to Kat to add to that as well.
I think you hit it the head. You hit it in the head, talaga, Tony. Having a healthy and regular routine has helped me personally with my mental health concerns. Apart from, seeking or being active with therapy. Oh, can you guys hear me?
Yes, I can
Yes,
hear you.
yes.
Okay. Yeah, yeah. I also really made an effort to listen in on what my mind and my body needed. So I wasn't very active with, for example, working out with my fitness, with checking in on and being mindful of what I eat. And I realize and recognize how being physically active has also helped me with better sleep, helped me, really look forward to something the next day. Having that kind of routine is very helpful because a huge part of why we, sorry, I feel like there's something really noisy. Hello? Oh, there you go. Sorry. Yeah, a huge part of why we feel anxious, why we feel scared over this pandemic, over anything really, why we're overthinking is because of that fear of uncertainty. And anxiety is caused by that fear of the future, even things that may not have happened yet. The way that our brains actually function is that it can't tell the difference between actual threat or perceived threat when we start thinking, overthinking, or we ruminate on problems and stressors that haven't happened yet. Having a healthy routine, finding ways that you can be more mindful in taking care of your psychological health, your overall well being, is very helpful in a way that you focus more on what is present. Breathing, like Tony said, is very important because when we breathe, it sends a message to our brains to calm down, to relax. And it's something so simple. And we forget these little things that affect our emotional well-being in big ways. So the fitness, the physical activities have been very helpful. Being a plantita is also very helpful. There's also research that shows that having or being surrounded by plants, taking care of plants, having that kind of environment that makes you closer to nature, releases those happy chemicals, the serotonins, and it's also very helpful in having that space or creating that space, physical space, where you feel more mindful, where you feel more at ease and comfortable, is also a big part. It plays a big role in our overall well being.
There. Thanks, Kat. So let's give April from Cebu a chance to ask her question.
Thanks, JP. Main gabi eh. Hi, Tony. Long time. It's such a good coincidence, happy coincidence to see you or hear you here on this clubhouse on Makati House. Thank you for sharing. Also to Kat, your initiatives and your programs. Actually, my direct question can we collaborate? That's like my direct question through some of our mental health advocacies as well. And I asked JP if it's okay that I also chimed in and share a little bit of what we're doing and hopefully engage not just with Tony and with Kat, but with everyone here in the room. So we actually have a sort of mental health, but also appreciation campaign for frontliners, because I think it goes without saying that every one of us is really having a tough time during this pandemic, but all the more for frontliners, especially those in the healthcare sector, having compounded all the stresses and the pressure they have to face every single day. So we actually have a campaign to really give them care packages and simply like what Tony was saying, having that opportunity or platform to share, to give back, whether to give, financially or donating money, or perhaps volunteering your time and your talents. Um, I completely agree with what you mentioned, how it's actually also good for you. And I've read several books as well, talking about the benefits of volunteering, the benefits of one giving back, or actually being part of a community that is um, really trying to make a positive impact. So yeah, I mean, that's just something I'd like to share, and hopefully Tony and Kat, we can connect. And if that's okay, if it's okay, JP, I'll get my 30 seconds. I'd like to share about our card deck. It's called My Soul Briefcase. So I really hope that maybe with MindNation and even with We Are Cora, there's going to be some ways that we can also work together and really promoting. And like you said, encouraging people to talk, encouraging people to invest in their mental health, and share different resources to do so. So thanks again also to JP and team for hosting this, and really putting this as a platform for Mental Health Day and mental health in general.
You're welcome, April, and thanks also. We're all in this together. So, last question from Happy Pinay.
Hello, magandang gabi, maayong gabi sa inyong tanan. My question is for both Kat and Antoinette. I can see a lot of community efforts for both sustainable products, sustainable communities. But since we're talking about mental health as our topic tonight, what are your strategies on how you communicate to smaller communities about mental health, and how do you effectively reach out to them so that perhaps we could apply it in our communities as well? And how do we collaborate? Thank you so much.
Thank you. I'll go really quickly first. When it comes to mental health, we actually don't deal with those programs yet with our communities. We're actually about to begin that journey together with Mind Nation very, very soon. But it's something that's always mattered to us because whenever we do have community projects, and we do our training needs assessments and our interviews with the women, a lot of the stories that we hear are very much actually about issues pertaining to mental health, or I would say traumas or experiences that they've been through, which is why it's something we have to tread very lightly and carefully because we are not actually the mental health professionals, but we would like to bring the support to them. And you'll be learning more about our journey, hopefully very soon, through our social media channels and our website. But Kat might also have some insights that might be more helpful as well when it comes to reaching out to communities and most especially vulnerable communities. But thank you so much for your question. That's really wonderful that you care enough to want to initiate this in your own space and in your own spectrum as
Thank you, Tony.
Thank you for that. I'm very excited to be sharing in the future the plans we have with Cora, because that's exactly what Tony and I were actually talking about, to be able to make it more accessible to those in need. But separately within Mind Nation, actually, when we started, the goal was really to be able to open up this discussion on mental health and see if there were people that were open to seeking therapy. We started by offering free sessions, and we realized that there were so many that from the youth sector that have availed of these sessions, because they also could not afford. They need the help, and they're the most open to these things. Um, we From our learnings, we also started opening up to those in need, like healthcare workers, and other community members that may not have the access or the ability to afford such therapy sessions or mental health programs. So what we do is we partner with organizations, for example, like Cora, with LGUs. Last year we partnered with the Pasig LGU with Mayor Vico Soto to provide free mental health programs for those in the city hall, as well as those in quarantine facilities. And it's something that we can continuously work on, for as long as we also get to actively support financially as well the mental health experts, the psychologists that also dedicate their time to the advocacy. Because, as mentioned already, it's there's not a lot of them at the moment. And they also need to be supported financially. So we want to be able to partner with organizations that can help fund and support these experts and link us to the communities in need.
Thank you, Kat. All the best to you.
Thank you. If you want to reach out for partnerships and opportunities, you can reach out to us at Cora through our website, wearecora.org, or hello@wearecora.org, or even with MindNation, hello@mindnation.com, or to me, kat@mindnation.com.
Wonderful.
All right. Okay. So I think that's a wrap. We're out of time. I think our guests are hungry, so we don't want
Uh-huh.
them to 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 be stressed. And actually, me too. I'm starting to get hungry. Um. So this is a wrap, and thanks to everyone for tuning in and listening. Also to here on Clubhouse at Makati House, and also those who are tuned in on Facebook, Twitter, and YouTube. So, and um, yeah, so that's it. And we will have another room for networking here on Makati House on Clubhouse. So I encourage everyone to to follow our social media pages, and also here at Makati House we'll discuss more on mental health and anxiety, other sources of anxiety that will uh that will cause stress or depression or other mental health disorders. So we'll turn this to another series like our sustainability talks and some announcements. So previously on Makati House, we had Lala Calle, a Filipina marine biologist studying sea snails and giant mollusks. She is also a sea glass jeweler, which leads us to help boost her sales. So they are launching a new collection at Sakilid Bye Bye. Check them out on Instagram for more details. That's Sakilid Bye Bye, SAKILID BAYBAY. We'll post a link in our show notes and on our social media pages. And then next Saturday, October 16th, we will talk about bicycles for healthcare workers during lockdown and bike lanes for a future with clean air. And then October 23rd, we'll do some trash talking again. We will discuss landfills and waste to energy. Is it really needed, and what are the risks? So, and we'll have a couple more, and that I think that's all for October. We'll do maybe three more in November and all the way to um, March 2022. So everyone, please stay. Follow us. And we're also on Apple Podcasts and Spotify. So if you like what we're doing and you think other people can benefit from what we're doing here at Makati House, please rate and review so other people can find us. So that is it. Thank you again. Thank you so much to Toni and Kat for starting discussion. I really appreciate this. And also on behalf of the Makati House team, thank you for lending your time. And I think I really believe reading all the comments and feedback from everyone, th- everything you shared was very helpful. So yeah, and we'll to end this room. We have a short message, a goodbye message from our team that we pre-recorded. So thanks everyone again. Have a great weekend and good night or good morning or good day if you're just starting your day. Bye bye.
Thank you, everyone.
Thank
Sending
you,
love and
Bye.
everyone.
blessings.
Thank
God bless
you.
you all. Bye bye. Thank you for
Bye.
having.
See you at Makati House after party.
Thank you for joining us at Makati House.
Thank
We're now
you.
ending the room. Here are some reminders. 5. Look after the land. 4. Plant a tree. 3. Teach